My name is Isaac Barayo, and for my 6th SportsMed 3 project, I chose to do post-surgical rehab of coronary artery bypass graft, also known as CABG. CABG is a special type of procedure that's used to treat atherosclerosis, which is a certain type of coronary artery disease. Single and double bypasses aren't usually done with surgery. Usually a surgeon will go in and insert a stent, which opens up the artery from the inside. If there are more than 3 arteries blocked, then the surgeons will go in and do grafts instead of using the stents. A good way to remember this is a higher number of blockages equals a higher complexity of surgery. The surgery is performed by creating an incision in the middle of your chest and then pulling your ribs apart. Once your chest has been opened up, you are hooked up to a cardiopulmonary bypass machine. This allows your heart to stop while the machine continues pumping oxygenated blood throughout your body. After you've been put on bypass, the surgeon connects the grafts that came from your legs, arms, or chest. After the grafts are sewn in, the surgeon will check for any leaks before removing you from bypass and closing your chest back up. Once the procedure is finished, the patient will be transported to the cardiac ICU. Post-surgical rehab for this procedure begins almost as soon as the patient is put in the ICU. The rehab process is divided into 4 phases: the clinical phase, the outpatient rehab phase, the post-cardiac rehab phase, and the independent ongoing maintenance phase. The first 3 phases of the rehab process can last anywhere from 6 to 12 weeks, while the 4th phase is lifelong. The first couple days after the procedure are spent resting in the ICU. This is where doctors will monitor your vitals and make sure that no post-surgical complications happen. Once the patient's vitals are stable, they no longer need to be in the ICU. The next few days are spent on the cardiac floor of the hospital, where the patient is prepared for discharge. While the patient is on the cardiac floor, they will most likely see a physical and occupational therapist. The patient will start with simple exercises, such as getting onto a chair, walking to the door, and walking through the hallways to help them gain back their strength. The focus will also be on getting the patient to start eating again, controlling their pain, and recovering through rest. The doctors will also monitor vital signs and check heart function through EKG. Once the patient is ready to be discharged from the hospital, the doctors will give them instructions on how to care for themselves. For example, caring for incision wounds, getting proper rest, and making sure not to do any heavy lifting. Phase 2 of the rehab process can last anywhere from 3 to 6 weeks. This is also where outpatient rehab begins. The physical therapist monitors how the patient's body responds to exercise, while the patient learns about exercising and monitoring their heart rate independently. Some simple exercises the patient might be doing during this phase include light walks on the treadmill, stationary bike, stretching, increasing range of motion, and light strength training. The goal of this phase is to improve a patient's cardiovascular fitness without overexerting their hearts. Phase 3 adds 3 to 4 weeks to the rehabilitation process. This phase focuses on independent rehab and monitoring while still under the supervision of a physical therapist. The patient is challenged with more intense exercises. This will help to improve cardiovascular fitness, which can be measured by an increase in exercising tolerance. During this phase, the patient will be reevaluated by a physical therapist. Common exercises in this phase include biking, walking on a treadmill, exercises for flexibility, upper body strength, and lower body strength, rowing, 6-minute walk test, and the timed get up and go test. Once your physical therapist clears you to exercise on your own, you enter phase 4 of cardiac rehab. At this point, physical therapists will have taught the patients how to exercise and record their vitals at home. The patient will be able to safely evaluate his or her own risk factors. Although the patient will be working out independently at home, they still have access to physical therapists if they have any questions or concerns. This phase will last for the rest of the patient's life.